The leg press primarily targets the quadriceps and the gluteus maximus, while also engaging the hamstrings, calves, and adductors. The movement pattern trained is a combination of knee and hip extension. This mimics everyday movements like standing up, climbing stairs, and walking uphill, all of which are crucial for maintaining independence in older adults. To begin the movement, press through your heels to extend your legs. Focus on pushing the platform away in a slow, controlled manner rather than driving with momentum. Your knees should stay in line with your toes the entire time. At the top of the movement, stop just short of locking your knees. This keeps tension in the muscles and protects your joints. Begin the descent by bending your knees and slowly lowering the weight back to the starting position. Aim for about 3 seconds on the way down. Make sure your back and hip remain in contact with the seat throughout the entire rep. Some key cues to remember are to drive through your heels, keep your knees tracking with your toes, and control the tempo, smooth on the way up and slower on the way down. Foot placement changes the focus. Higher targets glutes and hamstrings, while lower hits the quads. A wider stance works the adductors, while a narrow stance emphasizes the quads. A common mistake is letting the knees cave inward. This puts unnecessary strain on the joints and increases the risk of injury. Keep your knees aligned with your toes throughout the movement. Another issue is locking out the knees at the top of the rep. This transfers the load to the joints rather than the muscles. Always stop just before full extension to stay safe and maintain tension. Lastly, going too deep can cause the hips to lift off the seat, placing stress on the lower back. If you feel your pelvis start to tilt or lose contact with the pad, make sure you reduce your range of motion. To vary the leg press, you can adjust your foot placement, like we talked about earlier. You can also increase the weight or slow down the tempo for added intensity. Now, moving on to the seated calf raise machine. The primary muscles used are the gastrocnemius and the soleus, which make up the bulk of the calf. Secondary muscles include the tibialis posterior and other stabilizers around the ankles. The movement pattern trained here is plantar flexion at the ankle, or in other words, rising up onto your toes. The movement is essential for walking, running, balance, and maintaining posture, especially in older adults. To begin the movement, press through the balls of your feet to lift your heels off the platform. Keep the motion smooth and controlled. Avoid bouncing or using momentum. At the top of the movement, pause briefly to contract your calves. Think about lifting tall, not just fast. Then slowly lower your heels down until you feel a stretch in your calves. Let your heels dip slightly below the platform, but avoid letting the weight drop. Throughout the movement, keep your knees bent and relaxed and maintain contact between your thighs and the pad. Avoid shifting your hips or leaning forward. Key cues to remember are to push through the balls of your feet and to control the descent. A common mistake is bouncing the weight or letting it drop too quickly. This reduces muscle activation and increases the risk of injury. Always make sure you're controlling the descent and avoid using any momentum. Another issue is leaning too far forward during the movement. This shifts tension away from the calves and compromises posture. Keep your torso upright and your hips stable throughout the set. To progress the seated calf raise, you can increase the load, slow down the tempo, or perform the exercise one leg at a time. For beginners, reducing the weight or limiting the range of motion can help build confidence and control.